And today's session focusing on first-year Cleveland, and we're thrilled to welcome Bernadette Kerrigan. Bernie was selected as the founding executive director of First Year Cleveland back in December of 2016, so not even 4 years ago. She brought with her almost 30 years of experience, she brings with her today almost 30 years of experience in the nonprofit sector. She's worked at United Way in the Center for Families and Children, among others. She has a background in social work. If you have ever heard her speak about her current work, she approaches this with an unparalleled passion. She has made many inroads in her time at First Year Cleveland, but she will be the first to tell you there is much more work to be done. She was a recipient of a $4.8 million two-year grant from the state of Ohio late last year. She is a proud member of Leadership Cleveland 2008 and an even prouder mother of 2 daughters. So Bernie, thank you for joining us today.
Thank you. Cannot thank Leadership Cleveland, who is taking an amazing stance. I couldn't think of a more important time to talk to our community about what we all can be doing to address infant mortality, because it is addressing social justice. As you know, our community, our country, our state is really hurting right now. Many of us are angry, afraid, tired, and anxious as we continue to witness racism throughout our country. Our 400 years of slavery, Jim Crow, and continuous racism has impacted every part of our society, in particular infant mortality. The best news is we can do something about it, and the ones on this call, thank you. You had lots of places you could be today, and for you to learn more about this work is important. We are a public-private partnership created in 2016 to address infant mortality. This is our community's 4th attempt since 1960 to lower infant mortality rate, but this time we took a new approach. We decided it would be all data informed and no sacred cows. And so we have a film we'd like you to see that tells us what our data is telling our community and what direction we have to go. So if you can show the film, please. So we have exciting news to share that clearly what's been unsolvable for us for almost 120 years is solvable. We can actually prevent infant deaths. I was hired actually due to my years of working in moving individual behavior. But we realized the expected parent's behavior doesn't have to change. Us serving them has to change. So I'm working with hospitals, nonprofits, faith-based, education systems, employment systems, because for too many years we've been blaming the expected parents. It's actually us that have to change, and I'm really excited to be part of this change with this community. So I'll stop there and answer any questions about First Year Cleveland or the work of equity.
Bernie, thank you so much. And for those on the call, please feel free to begin sharing your questions in the chat box. To begin, doing this type of work, it's absolutely necessary to build collaborations with other partners within the community. Can you talk about what collaboration looks like for First Year Cleveland and how you have worked to build that collaboration?
Sure. Great question. I think that is what's really unique about First Year Cleveland. We have right now 495 partners. Some of them are individuals that have lost babies. Some of them are individual residents that are passionate about this. Others are nonprofit, faith-based, employment agencies, other things like that. I think once people saw that we had the data, we had a very clear direction and strategy to move. People began to see the buy-in. We also have been very authentic in listening. When I was hired, clearly I was hired to improve the prenatal care of all of our expected parents, to address teen pregnancy, to address severe poor or no prenatal care. But the data just wasn't there. We have very few teens that lose their baby. We have excellent prenatal care, people attending prenatal care. And so I couldn't be more proud that people were willing to stay at the table, look through data, and then actually draw conclusions that has been key to us decreasing infant mortality in a short time by 21%, and that's within all colors and all race.
And a key component of collaborating and working with those in the community obviously is trust as well. What are some of the tactics or ways that you've been able to really build some trusting relationships with your stakeholders?
It's a real good question. Again, trust is earned, and it's daily fragile, to be honest. I think one of the smartest things we did at the beginning was to have expected parents that have lost babies to be able to lead us through understanding their experience. And hearing their experiences gave us a new appreciation for maybe what the problem should have been looked like, or it should have been, the narrative should have been, versus trying to blame the expected parent. But that is ongoing. We continue to work daily. Staff, all of our volunteers, we're a very small staff. We're 4 staff members, but we're overseeing 13 action groups that can have up to hundreds on them at any given time, that have direct charters, work breakdown structures. They're very strategic. They're very accountable for their work. But staff and volunteers wake up daily reminding ourselves that we must authentically listen, we must be trustworthy, and we must be willing to learn and hear things that are sometimes hard to hear. And so we continue to work on that. But I think anyone in this community knows any good collaborative, if you want to come to the table, it's because you trust the people who are leading those tables. And so we've worked really hard. We have some parents that have lost leading groups, and then we have more informal leaders. We have residents, we have students. So I think we have a nice combination, but we don't take that for granted every day. We have to earn that trust.
Can you expand on your comment that changes are needed by institutions, not the expected parents? What organizations, how have they been changing, and what more do they need to do?
Sure. I think our best example is the healthcare institutions that I can't be more proud of. So they let us independently interview their expected and new parents that had lost babies. And the experience of an African American, Caucasian, Hispanic, moving through the healthcare system was very, very different. And so couldn't be more proud of the hospitals now that hearing that information, we created posters, we created blogs, sharing those experiences. They have made mandatory racial bias testing and training. And so they have really come to terms that each of us bring biases to the table, but when it impacts maternal and infant health, we're going to check them at the door. I'm now hoping that there's some people in this audience that are willing for employment, education, nonprofit, faith-based to take that lead. I'm really hoping foundations will make it mandatory of racial bias testing and training. I think all of us, including myself, come with biases, and if we don't have the tools to know how to check them at the door, to be aware of them, and then how to mitigate them, we are as much as the problem as the solution. So there's a lot of good HR tools. We just got one as 17 of the largest grants from March of Dimes around the country to bring more racial bias tools to the table. If anyone hasn't gone to REI, it's a gem of a place. I think we're seeing a lot more. We partnered with the YWCA on an equity conference. So I think there's a lot more places for all of us to go to explore the issue of our own individual, and assume if you go to work, it's multiple individuals' biases and policies that are creating this problem. So looking at your policies, especially HR, vendor, hiring, etc.
And given much of the recent events and movements, how has First Year Cleveland responded to or collaborated with some of the movements, much like Black Lives Matter?
It's a great question. Once we finalized our strategic plan, which was late 2017, where racism was key, we really strategically invested time to make sure we got involved with many of the founding legacy agencies around our community working on racism, and couldn't be more proud that coming out of our conference that called racism as a public health crisis, we teamed up with the United Way, who's been phenomenal, United Urban League, NAACP, Birthing Beautiful Communities, and I'm missing one, but I'll find out. So it's just been one of those that we continue through our work to add more partners that can help us understand the issue better. First Year Cleveland, again, is one of the younger organizations, so we know we're standing on the shoulders of many legacy agencies, especially in our community, that has been working on racism for a long time, and we're just proud that we could bring our expertise, our trustful partners, and I think that was key to declaring racism as a public health crisis, because we were working so closely with the City Council on infant mortality, and they had seen our data on how racism is killing our babies.
And speaking of the city declaring racism as a public health crisis, how does that impact your work moving forward?
Hopefully it will impact everyone on this call's work moving forward. We're really thinking through very thoughtfully of how does racism fit into all the social determinants of health and all of our systems, and trying to give a roadmap that if we're willing to change, what would be those steps that would give you the best return on investment. So I'm not only hoping First Year Cleveland is will be open, our executive committee and staff, to making changes necessary, but all of us. And we're really following Seattle, who has probably the most robust roadmap of how to really call out equity and to actually put it into action, and they've seen some great results.
Are there other policies within Cuyahoga County, the city, or even at a state level that you would want to advocate as change, or are currently advocating for change?
Really good question. One of the first things that we asked for at First Year Cleveland was to have all policies reviewed with an equity lens. So to be honest, many policies that are sitting on your local city, county, state level were written during the time of slavery or Jim Crow. So we're asking, it's one of the first asks that we've made, that we're thrilled that getting this declaration from the City Council will give them the tools and the ability to start looking at all their policies they have created over the years and put them through an equity lens. We are doing the same. We are launching next month our next strategic plan. We're just wrapping up and finishing all of our milestones of the first one. And we are asking to bring in an equity expert to look at all of our policies, from hiring to who we give out grants to and vendors, and to give us a scorecard of how are we doing within an equity lens, and then what do we have to mitigate immediately to course correct so we are doing this well. It's one of the biggest things we're asking people to do, is to look at your policies. And if you need any help with any consultants or work with that, please contact me.
So through the work that the organization does, you have great data, great insights, great information. How do you get that information that's so critical out to the community so we're aware of what you're learning?
Yeah, it's one of the things I hope this community can come to a better solution. Right now, we're putting it on First Year Cleveland's website. So you will see, prior to First Year Cleveland being created, we would get infant mortality data once a year, 18-month lag. And we are now putting it monthly with only 1 month lag. And that's not only infant death data by race, but also premature data. We are starting to collect other data that's on our dashboard on our website. But I think it is one of the things we can improve the most is this community has a lot of data. And we don't have typically one place to store data, especially data that has to do with equity. And so we do hope there will be a solution for our community within the next 6 months of where can we all place our data and how can we all view data a lot easier so we can be able to make sure we not only change the narrative, but the narrative is data informed. So if anyone has solutions in this group, we'd love to hear them, or if they're doing this at a smaller scale and would be open to do it at a larger scale. I think this is a significant gap in our community.
And as you look at yourself in this role, what have been some of the biggest challenges with your work, and how have you worked to overcome those?
Sure, I guess first, personally, when I was hired from Case, who is, I'm housed at the Case School of Medicine, we have an executive committee of 17 that has, hires me, hires, fires, evaluates me, etc. But I am within the structure of Case School of Medicine. It was the first group on my first day that I actually took a racial bias test. Now, I've committed over 35 years to this community. I adopted 2 girls of color from the Department of Children and Family Services, but I was never aware of my own biases. And for Case to have new employees take that test and become more aware, I had to go home my first day at work at Case and actually talk to my kids about my own biases and the importance of mom checking the biases to be the best mom I can be for my kids of color and to do my work. I'm thrilled that the board has hired a mentor for me and somebody that can help be in meetings with me, coach, and see maybe some of my biases come out, my blind spots that can help course correct it right away. Dr. Arthur James has been invaluable to me personally and professionally in learning about my biases. This is a journey. Our biases aren't wrong. It's just the history of 400 years is something that I can not underestimate how it impacts me in my decision-making, my hiring, my policy making. So I spend a lot of time right now intentionally understanding my biases and having as many people check me and to help course correct me, because this work is way too important. So I think that's probably, I wish when I was overseeing millions and millions of dollars annually for United Way, I actually had an equity lens to look through. As a social worker, when I was doing counseling, my important work, 10 years at the Center for Families and Children's, I did phenomenal work, but I would have actually helped the community a lot more if I had a better understanding of equity.
And as you continue to look forward, how can we as community members help you in your work to address these challenges and these disparities?
Sure, I think one is doing more sessions like this. hard one on this one. I do better on dialogue back and forth. So I think as many as we can even put together small groups. I think there'll be some follow-up material being sent to this audience. I think there's a couple things. I strongly encourage everyone to attend Racial Equity Institute training. Strongly, if you have not watched the film Toxic, it was a film created by our partners at City and First Year Cleveland, and it was written, the script, by African-American families that have lost. And I think as much as we can all understand what is being faced by a lot of our brothers and sisters in our community, and whether it's through reading, dialogue, and other things, I truly am very strong that every organization, nonprofit, public sector, private sector, should be having mandatory training on your racial biases, testing, training, coaching, mentoring, and have an honest review of, or an independent review of all of your policies through an equity lens. It's just critical that I think your voices all have to be heard. I think the protests have really been important for all of us to see the pain in many people's eyes. This is preventable. This is stoppable. But we have to own the 400 years we were all part of, and we all have to move better by doing better.
And Bernie, we have a question of where can we view the movie Toxic?
Sure. So it was one of the documents I gave you guys for follow-up. So it gives the information of how to order the movie Toxic. There is a facilitator's guide. National Geographic, we thank them, donated time to put that guide together with us. Larger groups are able to get some of the African-American leaders to speak after you use that facilitator guide. So there will be a follow-up material sent to the audience here, and one of those pieces, one of those documents is how to order Toxic.
Great, and we have time for one final question. You mentioned mentoring. Where would you recommend in this space to seek out mentoring, whether a person or an organization?
Sure. A couple of us are actually putting together a list of people, but if anyone individually, the information I sent out does have my phone number and contact information. I know I've contacted a few folks that are doing other mentoring to people on our executive committee or our action teams. So I do have a few names and phone numbers, clearly of the person who's mentoring me, but of others in this community. I think what our goal is to have up on First Year Cleveland a pretty thorough list with some bios, so people can look through those and contact people that they think would be a good fit for them.
Well, Bernie, we thank you for your time today, your leadership in this space, and also your openness in sharing your own journey in discovering biases to lead within the community. So thank you for that. And with that, I'm going to turn it back to Marianne.
Thanks.
Thanks so much, Rachel. And Bernie, thank you. Thank you for the great work that you're doing for the babies in our community. And thank you for the similar work you're doing to open all of our minds and our hearts so that we can check our biases permanently and move forward as a community, which is what's desperately needed in Cleveland. So thank you.